Let's welcome our guest. Dr. Samuel Mwaura is the County Secretary for Nakuru County. He's here with us this morning. So as we bring the mic to the ground, we start the conversation from the executive officers level, and then we talk to the citizens in the next hours. Good morning, Dr.
Thank you. Good morning. Again, my name is Samuel Mwaura, the County Secretary. Thank you for this opportunity. Thank you to Nation TV na karibuni Nakuru.
Asante sana.
Thank you.
Bonasia, the first thing, tafadhali, the officer who was supposed to switch on the sun this morning, alichelewa. Hey, si tumepigwa na baridi.
That's the beauty of Rift Valley. It's usually very cold in the morning, lakini unaona jua imeanza kukuja.
Yes.
Yeah.
It's a lovely city, and here we are at the Nyayo Gardens, beautiful park. And we said, just as we were heading into the last hour, we want you to first of all tell us, this park, is it public, open to the public throughout? Do people pay, or is it free?
Thank you so much. I want to start by bringing the greetings from Her Excellency the Governor, Madam Susan Kihika, and her entire government. And I want to start by saying, yes, this park is a public park. It's a free park. And I want to say within Nakuru City now we have two parks. This is not just the only park. We have another park near the bus stage called the Lions Garden Parks. And both parks are available for free to the public, and they are very accessible. The county government of Nakuru has a budget for maintaining both parks, maintaining the ground, but also the parks are available for hiring for those who want to use them. But the parks to the public for utility on day-to-day basis, it's available for free.
Right. We took a nice shot of the park earlier. It's really beautiful. I know we'll take one. I can see Chris is already panning. There we go. It's quite stunning, very green, very lush, right in the middle of the CBD. So it's a nice break from, all the brick and mortar. You can come and take a walk, sit, take a nap, have your lunch, bring your family, whatever it is. So I really do like it, Doc. I was going to ask, as far as public spaces go and green spaces go, you already have now two parks, so I'm really glad. Lake Nakuru National Park as well, really beautiful. Is it part of the county agenda? But even before I get into that, when we hear county secretary, we're really trying to break down how government works, how national government works and how county government works. So what does a county secretary do?
Thank you so much. So the job of the county secretary, basically one, he's the secretary to the cabinet, that is the county executive committee. The county secretary is also the head of the public service, which means that I oversee the service delivery on day-to-day basis within the county government. I also coordinate things that are cross-cutting within departments. You realize this, like what are very cross-cutting. Some aspects of the health sector are very cross-cutting. Yes. So any cross-cutting issues within the government are coordinated within my office. And I'm also the contact person between the county government of Nakuru and the outside world. Could be the other counties, could be the national government.
All right.
So in a high level, that's basically my responsibility as a county secretary.
It's quite a big one. Public service being the heaviest thing I've heard there, one of the, and being an intermediary as well. But yeah, I was going to ask if it is part of Nakuru's plan, strategy, short and long term, to create these kinds of these kinds of green spaces. When you're upgraded to a city, the assumption would be, sasa yenu ni skyscraper, But what is the importance of greenery for Nakuru County and Nakuru City?
Thank you so much. Yes, I want to start by saying it's a strategy by Her Excellency the Governor to make sure that we preserve and rehabilitate all the public spaces that are available. I want to say since 2022 when the Governor came in, we have two parks that have been done. We have the Lions Garden Park, which I've talked about, and in Naivasha we have a park that has been done in Naivasha. In Gilgil, there's a property that has been identified that is being considered by the municipality for a park. And outside the city, within the other places where we have public spaces, like we have the crater within the crater space within the Nakuru city, that has been fenced off with a collaboration between the county government and the national government to make sure that those public spaces are protected. If you go to the areas of Lake Naivasha, where we have a lot of walking spaces and public spaces, Lake Elementaita, there are so many projects that are being done to do surveying so that the spaces that are available for the community to go and enjoy and relax, and also to preserve the environment, have been protected. The Department of Environment under the Governor is very intentional about making sure that they invest in these public parks, they protect them, and they also manage them. One of the projects that has been done in this public park where we are seated on the last 1 year is that there's a borehole that is coming in. You can see it on the other corner, because we realize that when the public comes here, the consumption for water is very heavy. The need for maintaining the park, this green space you see, it requires a lot of water. So to make sure that the public does not incur cost in the future, that's why investment in boreholes, to make sure that the park is self-sustaining and that the resources that are needed here are available within the park. So it is a strategy to make sure that we preserve the park. Secondly, within Nakuru City, we have a project that is going on called VEI. We call the Sponge City concept, which we are working with a partner called VEI. The project is a partnership between the county government of Nakuru and Netherlands. And basically, we are looking at not just now public parks in terms of preserving the environment, also looking at other open spaces. You realize that now we are doing more cabro rather than tarmac around the city, so that we can make sure that whenever we have rainwater permits, and we are also now recharging our ground, it's also a strategy of making sure we rehabilitate and preserve our environment and our public parks.
Okay, I didn't know that. So cabro allows water to seep in?
Yes.
Tarmac, it just goes
The water
over.
just goes to the lake, and then we start having issues of flooding. So you'll see for Nakuru County government, for the last 2 years since Her Excellency came in, through a research that was done, is that we are now doing more cabro to allow that, so that water can seep into the ground. If you realize our lake Nakuru has had issues of water just going to the lake, carrying all the silt to the lake, and therefore we had an issue of flooding, because as the silt is going to the lake, means the water has to occupy more spaces. And therefore that's very intentional to make sure that we preserve the environment within the city.
Okay.
You know, when you think about the services that our county government should be giving to its people, it's all about service. Our government is actually there so that you can serve the people. And you don't just serve the people by putting up brick and mortar, because that's what we saw in the onset of devolution. There was a push and rush to have brick and mortar. Let's have, hospitals, let's build this and the other. Let's build county headquarters. Let's, put up brick and mortar. And we forget about just the wellness of people, which is why, just like we've started this conversation on the green spaces, and we wanted to have a conversation around here where we showcase that green spaces are important for people to come in and chill. Are you able to tell from just having refurbished this park, how many people access the park on a daily basis, on a weekly basis, on an annual basis? How many people does it serve? How many people actually walk around and they feel, let me go and just relax at the park?
Thank you so much. I may not have the figure for the monthly or annual basis, but on daily basis, because I also visit this park. If you come here during the day and you observe at the end of the program, you not lack more than 200 people at any given time sitting in this park. The park that is next to the stage and the market is even busier. You could find about 350 people sitting and relaxing or waiting for their transport in the park. And therefore, it's a very busy park. And you realize whenever we have an event here and when we close the park for a day, the committee is always saying that make sure that even if you have events, the park is still available. So we also try to minimize events here because the demand from the community is very high. Additionally, when people are here able to enjoy free Wi-Fi, which is provided by the county government, so the demand for the park is very high. And people don't just sit inside the park. You realize even that outside the park, we have some trees that have been planted and some seats that have been arranged there. So we also have people who are able to sit by the fence of the park, outside the park, and enjoy the same services, including the free Wi-Fi.
Okay. Dr. Mwaura, we wanted to have a conversation around, devolution, whether devolution is working, the budgets for devolution. Just like we said, today, the mediation committee of the Senate and the National Assembly are meeting to talk about whether they can increase from 405 approved by the National Assembly to 465 as being proposed by the senators. If we come to Nakuru, what is the current financial year that's about to conclude in a few days? What has been the budget for this financial year? And then let's look at what value is that to the citizens. What's your budget, your annual budget, even if you don't have the exact figures on the averages? And then what value do the citizens get out of that?
Thank you so much. And it's a very good conversation that you're having, because I have to start by saying that I was lucky that I was working in county government since devolution. And I have to say that devolution is working. And looking at the services that have been devolved, if you compare the health sector before and after devolution, there's a huge difference. So the budget for the county government of Nakuru, the upcoming, the next financial year, because we are concluding the budget, is about 20 billion Kenya shillings. This budget has been divided into various sectors. We have about 11 critical sectors. But the biggest sector is the health sector. And the health sector will take about 40% of that budget into the health sector. So what is the importance of this budget to the people? For example, starting with the health sector. The 40% that is going to the health sector, one of it, we have very many hospitals that were started by the previous regime, about 14 hospitals. And in doing hospitals, most of these hospitals were found at about 15 to 20% completion rate. Over the last 2 years, there has been huge investments to make sure that these hospitals are completed. And when Her Excellency came in, the first commitment for her budget was to make sure that we complete the stalled projects. I want to start by reporting the first 2 years. Some projects that have been stalled for years have been completed. For example, in the health sector, there's a hospital that was started in Lare called Lare Model Health Center, which was started by the late Kibaki in 2009. The project has stalled since 2009. And in the first financial year of Her Excellency the Governor, a budget was allocated to complete that hospital, to rehabilitate it, and now the people of Lare are enjoying the services of that health facility. So the 40 billion that has been allocated this year is going to build new facilities.
8 billion.
Sorry, the 36%, the 40% of the budget that has been that is being allocated to the health sector, the one we are discussing, the one that are going to Senate,
Yes.
40% is going to the health sector. So 1.2 billion of that budget is being dedicated to complete all those health facilities that were left stalled. For example, to give an example of Molo Town, there's a hospital that was going on. It has been funded to a tune of almost 150 million the last 2 years. It has been given the final 94 million the coming budget. So that hospital can be completed and the facility can start being utilized. This hospital has a collaboration with Safaricom. We already have received equipment for operationalizing the maternity of this hospital. And so by putting this 94 million, the people of Molo will now have maternity services and a hospital, level 4 hospital that is dignified, and they'll be getting services in a dignified manner. So these hospitals are all over. You go to Maimahio, there's a facility that has been going on. It has been allocated the final tranche of about 73 million next financial year for completion. So the amount of money that has been invested in the health sector the last 2 years and the remaining 2 years is so huge that in the county government of Nakuru, by the time you are done with this health facility, every sub-county will have at least a good level 4 hospital, which is offering services to the people of that sub-county. The level 5 hospital has not been left out of this budget in the coming year. In the previous 2 years, a lot of investment has gone on. And there has been a story of a trauma center that has been installed in level 5 hospital since 2009. You remember the Changwan fire incidents.
Yep.
Again, Her Excellency has been engaging the president. And recently, 2 days ago, you're in State House, and the president has instructed the military to come and assist the county in completing that facility. There's another facility that, again, has been talked since 2009 because of Changwan fire incidents in Salga. A property was bought in 2009 for construction of a level 4 hospital that has a capacity to offer emergency and critical care services. That story continued being a political story until Her Excellency became the governor. And I'm happy to report that that facility is about now 30% complete. It was started around 2023. The contractor is on site and the work is going on. There are 2 sub-counties.
Where is it exactly in Salga? Is it in Salga?
As you drive down Salga, before you get, you know where the police normally, where we have the police barrier.
Yep.
But on your right, there's a facility that's being constructed there. It's a very big hospital, almost $500 million in construction. Equipping will cost probably 750 million Kenya shillings. So it's a very massive facility. So that vision and that dream, the suffering that the people have gone through in Salga, where people have accident and there's no immediate critical care accident, that will be a story of the past. You go to some sub-counties that didn't have a level 4 hospital at all. You go to a sub-county like Molo, they had a level 4 hospital. It's being upgraded. But if you go to Rongai, if you go to Subukia, if you go to Kuresoi North, they didn't have a level 4 hospital. Those people basically had health centers and dispensaries. If mothers needed a simple cesarean section, they had to be referred all the way. So within the health sector, again, those 3 sub-counties, Subukia Hospital is over 95% complete. It was started in 2022 when Governor came in. When Her Excellency Madam Susan came in, the Kuresoi North Hospital is also about 40% complete. It was started in 2023, and now Rongai Hospital, the one in Salga, is going on well. So the investment in the health sector have turned into service delivery, and it's not just brick and mortar. Because again, if you look at the issues that have been there since devolution about the health sector, the issue of human resources is a very critical issue.
Yeah.
Sure. We have had unrest in the health sector because of lack of promotions, because of lack of recruitment, and because of terms of service which the healthcare workers didn't agree with.
Delayed payments.
The late payment of salaries
CBAs,
and all those things.
Yes.
I want to report that in Nakuru County, the budget that have been allocated the previous 2 years and the upcoming budget, promotions have been done. And so far, about 600 healthcare workers have been promoted. And across the county, all departments, promotions are going on. That's a very key issue for our healthcare workers because it's also a factor of motivation. The other issue that has been resolved in the health sector using these budgets we are discussing is that we had what we used to call, we inherited a hospital contract. Our hospitals were employing nurses, doctors, all manner of employees through what we call the Facility Improvement Fund. The terms of service for these employees were very different. We had a situation whereby we had a clerical officer earning more than a nurse. We even had a casual earning more than a nurse. We had 2 doctors in the same facility, one earning 110,000, another one earning 215,000, employed on the same day doing the same job. So again, using the resources that are available in the county, the terms of service have been harmonized. Everybody is earning their salaries. And even those whose terms of service are still, you're either on contract or on permanent and pensionable. The other thing Her Excellency has done to address, again, the issues in the health sector using this budget, the 40% we are talking about, is to make sure that we have additional recruitment. So that at least because again, our staff are very strained in the health sector. So by recruiting more, we're able now to alleviate the burnout that is there in the health sector and improve the quality of services. So the investment that is going on into these service delivery areas, the health sector being the most developed sector, is translating into the health into services to the people. If I could come to the Department of Agriculture.
Before we go into agriculture.
Yeah.
Okay, I know you have one
Yes.
follow-up.
Community health promoters, maybe you touched on it.
Yes, thank you so much.
Because I hear you're talking about level 4s and 5s, 1, 2, 3. I'm not hearing much of talk on, community health promoters and facilitating them, going to a dispensary, going to a health center.
Yes.
Thank you so much. Nakuru County, we have a very robust primary healthcare services. And I have to say that we have 3,300 healthcare promoters, community health promoters. I want to say the discussion about community health promoters began in Nakuru, and we are very proud as a county. And so far, our healthcare promoters, community health promoters are getting a stipend from the county government, 2,500, and from the national government, 2,500. Part of these resources are being used to pay for them SHA because they cannot be offering services and they cannot get services. These community health promoters have been trained. They have been trained on the services they are supposed to be offering. They have been given the facilitative equipment, including the referral systems, the referral equipment that they need. They have been given simple diagnostic tools. They're able to do simple diagnostics and they're able to refer to the nearest health facility. So we are working very closely with them to make sure that any problem that is in the community is referred to a health facility. They're able to offer first aid and advise the clients. On top of that, within the community structure, we have what we call the primary healthcare networks. It's a strategy that is there to make sure that as we're implementing SHA, we also restructure our health sector to align with the new SHA reality. It requires that in Nakuru County we have the 16 primary healthcare networks. That's to mean that now our health centers are not operating in isolation to the level 4 hospitals. So we have a system here now from level 1 to level 5 hospitals. We have a system of referral and making sure the referral both ways. Either you're referring to the hospital or back to the community. Could be you're referring a sample, a patient, or you're referring an information back to the community. So the primary healthcare network, one, we're able to organize the sub-county, for example, Gilgil sub-county. It's one primary healthcare network. The healthcare facilities that are within the sub-county have technical support from the sub-county MOH. Within the sub-county MOH, we have a team of experts. We're able now to even give clinical guidance to the healthcare workers who are offering services in the lower health facilities. These experts are also tasked to make sure that they visit these health facilities, they provide health services together with the nurses on the ground. They're also supposed to be doing community outreaches. There are places we don't have yet health facilities. There are places we have poor health-seeking behaviors by the community, and therefore we go to the community to offer outreaches through these community health networks, so that we also promote health-seeking behaviors and encourage people to come to the facilities.
So let's talk practically. We've said Gilgil sub-county, so let's work with Gilgil sub-county.
Have we talked absorption of the CHPs?
Those are the ones.
Okay.
So at the Gilgil sub-county, you have CHPs who are working, right?
Yes.
And one CHP covers 100, is it how many homesteads?
Households, yeah.
Yes.
100 households per CHP.
Yes.
100 households. Is a CHP resident within these 100 households? Or do they have to come from somewhere else?
One of the requirements for you to be a CHP is that you must be a resident of that place. You sleep, you wake up there. If you're doing a business, you do a business there. You must be a person who is known by the local community, an opinion leader of some sort. So you'll find some of them are former businessmen, former nurses, former teachers. So they're serious opinion leaders, but you have to live within the community.
Okay.
You cannot be traveling back to the community to offer those services. If you look at the stipend they get, in itself is not enough to transport you from wherever you're coming from back to the community.
Exactly.
Yes.
So within that 100 homesteads, is there a level 1, a level 2 dispensary where they're able to refer to. So we are sure that pick a place in Gilgil. Just tell me.
So what happens is the community health units are structured around health institutions. So the requirement by WHO is that you're supposed to have a health facility every 5-kilometer radius. And therefore, within that 5-kilometer radius, now you cluster the villages so that now you have community health units. So the 100 homesteads now become what we call the community health unit. So all those units are connected to the nearest health facility. And therefore, the referral system becomes very easy because these community health units now attached to this community.
So it goes on.
It goes on. From the dispensary, now you are connected to the next health center. The health center to the lowest, to the next level 4 hospital, and eventually to the level 5 hospital.
You know, I'm asking all these things, Mariam, because remember yesterday when we had a conversation and one of our people on the ground, Joy, was telling us her own experience of having to cross over. Crossing from Ngata to come and look for a health center on this other side. And that's why I was asking the CS, Dr. Mwaura, are all these community health promoters actually linking people to a functional dispensary? Are those functional dispensaries then referring upwards to a functional health center and so on and so forth? Are you sure?
Yes, I'm sure, because I can tell you, for example, within Ngata, we have it's within Mosop ward. We have a facility that is very near to Ngata. It's only that the facility now you'd have to drive from the tarmac towards the inside of Ngata. You know where the Ngata police station is?
Yes.
If you drive inside there, you have I can't remember the name of that center, but about 2 kilometers inside we have a health facility. But you realize Kenyans who are along the highway prefer to take a matatu to the next town. But within Ngata area, we have enough health facilities and we're able to do referral within the area.
Okay. There was also the question of drugs and their availability at said facilities. About 2 or 3 people yesterday said, I was treated well and good. Time for drugs. I had to go out of pocket into a chemist outside of the facility. Dispensing of drugs.
Now, the issue of drugs and health supplies is a discussion that we must continue having as a country. Because when you talk about shortage of drug, we have it in 2 levels. We have what we call, sometimes we do have stockouts in some facilities.
Right.
But we also have an artificial stockout that is caused by us, the professionals. I'm a trained pharmacist by profession.
Yes.
And in Kenya, we have what we call the Kenya Essential Medicines List. And every practitioner, because this list is developed by all consultants, all professionals within the health sector, will come together every 4 years and review this list and decide for treatment of this condition. This will be the first line, this will be the second line, and this will be the third line. And therefore, in stocking, because we also cannot stock everything, because in Kenya, I can tell you we have about 22,000 registered molecules. We can't stock 22,000 registered molecules. So the public health sector is arranged in a way that we have molecules that are affordable, effective, and with less side effects are stocked in the public health sectors. So if a clinician prescribes a molecule for treatment of a condition outside this list, they are causing an artificial shortage. But what we are doing within our health sector, we have implemented what we call the medicines and therapeutic committees, which in these we have nurses, we have pharmacists, we have dentists, we have doctors, we have clinicians, and they're able to sit down together and have a discussion so that we stop having people prescribing outside the essential medicines list.
So is it a case of, I'm trying to think of it practically. I go to a health center, I'm told perhaps you need antibiotic X. Antibiotic Y could do the same job and is available here, but I'm prescribed antibiotic X.
Yes.
And now I have to go outside to a chemist to buy said antibiotic.
You're very right.
So then why would the healthcare provider then prescribe me with that, knowing full well it's not available within the facility?
Again, it's not every healthcare provider who is doing that. I have to say we have a few people who are doing that because that's a malpractice. So apart from enforcing the policy of having medicine and therapeutic committees, we're also doing regular audits to make sure that if any clinician has been doing that practice, we correct them either through training, we talk to them, and if need be, we take a disciplinary action. Because then you cannot be causing an artificial shortage, whereas we have an alternative recommended molecule as a national policy. The second issue is true, sometimes there are stockouts. And you realize in Nakuru County, Her Excellence has been very transparent with the budget that is allocated to the health sector for drugs. Every quarter, we do a flag off of the commodities we buy. We tell the community how much has been distributed, how much is remaining in the budget. And therefore, we have sustained the supply of commodities for the last 2.5 years since Her Excellency came in. And I can say that we have 2 levels of commodity supply. First of all, we buy our drugs purely from KEMSA because of price, because of quality. And when KEMSA doesn't have some of those supplies, we go to MEDS, because that's another institution that also guarantees good price and quality. So we have direct delivery to our health facilities, but we also retain a small buffer at the headquarters, so that in case they had not done good projection and they ran out of stock, we're able to replenish them in a short time, so that they don't have to stay out of stock as we are doing the ordering. Okay. That strategy that is there to make sure that we address this. I think we have had a conversation that the whole country is establishing facility improvement fund, so that the facilities are able to retain some money. That's a policy that has been operational in Nakuru since 2014, when Her Excellency the Governor was a speaker then. Yeah. We did develop a policy, and we entered the Facility Improvement Fund. And therefore, since 2014, and it has been improved in terms of management, the Facility Improvement Fund, the facilities are able to retain the money they collect as user fee, and they're able to also budget at their level, and also supplement the budget for drugs and medical supplies, also to make sure that we reduce on the stock out.
I don't want to lose this train of thought. How much does Nakuru County owe KEMSA? Because KEMSA is almost on its knees because of pending bills from counties and from national government as well.
Counties, mostly counties.
Mostly counties, yes. It's ridiculous amounts, and yeah, they are unable to do their work effectively also because of pending bills. How much does Nakuru County owe?
I can tell you we owe KEMSA nothing. If we have any money, we owe them, because for KEMSA, the way they look at debt, you have to have stayed with their money for 90 days for it to be considered a debt. We have been able to service pay all for the supplies they have supplied to us within 90 days.
That's good.
So even if you have any money, because they brought us a supply about 4 weeks ago, I'm sure the payment is being processed, but we have never had an issue with debts with KEMSA as a county.
That's good to hear. That's really good to hear, Doc.
Let's take a break. We're having a conversation with Dr. Samuel Mwaura. He is the County Secretary for Nakuru County, micro-ground in Nakuru at the Nyayo Gardens. Beautiful, beautiful gardens here, open to the public, where the public usually come and they just lounge. The only issue here with Nakuru, it's coming up to 28 minutes to 8. Najua bado haijafika. It's still cold.
Tutampigia simu.
Hey. Actually looks like it's about to rain. That's even scarier.
So Dr. Mwaura is the County Secretary. He's Head of Public Service for the county. As we come back, you know, everything that I'm hearing you answering, Dr. Mwaura, like since Her Excellency the Governor came into office, you've served in the county in the devolution space for now 13 years, now 12 years. Yeah. Where is the independence of the public service when public officers talk about, you know, the current administration, and so on and so forth? It's a political question that I have to ask you after the break. Stay here. We'll be back shortly. Yeah. So in the next hour, we want to have all the citizens. We'll be having a conversation with some officials of the county government of Nakuru. Plus, we also want to hear from the citizens. The citizens also talking to the officials of the county government and telling them these are the areas where we see it's working. These are the areas where it's not working. This is how we'd like to work collaboratively to fix the issues. Yes. All right? From Nakuru. Bona CS, I started by asking that question. You worked in the county government of Nakuru in the first devolution government of 2013 to 2017. You're here now. You are the county secretary. You're in charge of the public service. Is there a feeling of independence of the public service from the political administration? Because political administrations keep changing. We are now in the third administration of Nakuru. But the public officers who work for Nakuru, they work for the citizens of Nakuru. Is there a feeling of independence, like I am here, I am permanently employed, or I'm working for the people of Nakuru? Whoever comes in at the top offers us the, the guidance of what we do and the policy direction, but then we are still doing the job that we ought to do.
Thank you. And I have to start by observing that one of the most important jobs of the county secretary and head of public service is to shield the public service from politics. And one of the easiest way of politicizing public service is when you fail to facilitate civil servants to do their work, when you fail to promote them, because then they have to go to politicians to lobby for resources, to lobby for promotion, to lobby for their welfare. And in so doing, politics infiltrate the public service. So I have to say that from the beginning, Nakuru County has tried to maintain professionalism in management of the public service. The only challenge we had at some point is where we had public officers, procurement officers being transferred and being called cartels. We had ward administrators being mistreated, you cannot tell people to go home without a due process. But I have to be happy that when Her Excellency Governor Susan Kika came in, there's a first task force she formed, which was a cross-cutting task force to reform the public sector. The task force had several mandates, and one of it is to look at the resources needed to do promotions, to do redesignation, and to make sure that this process is done. that has been done over the last 2 years, and you realize now most of our civil servants are not focusing on lobbying for promotion or such kind of things or politics. They are now focusing on working. The other job that this task force had is to make sure that we automate our human resource services, because again, the promotion process was very political. My file is forwarded to the Public Service Board for promotion. One letter is missing, and therefore I miss a promotion. I wait for another 2 years. In that process, I go to the assembly to talk to my MCA. I'm feeling aggrieved. I'm on social media making noise. And therefore, digitizing health records, digitizing civil servants' record, their staff file, their procedures when you're applying for leave, brings a lot of transparency. And that system has been procured, and we're almost there. It's a very tedious process. The register has been reconstructed, and therefore I would say that the public service in Nakuru has been properly reconstituted. The terms of service are being harmonized, promotions have been done, and therefore it's shielded from politics.
Okay.
The other key issue that brings politics into public service is tools of trade. For example, when you have enforcement officers who don't have a uniform, you know, now, first of all, they'll go to town, they'll have conflicts with the community because they're not in uniform. The community will call in the MCA. The MCA will want to know who are these strangers who are harassing my people. And therefore, politics come into the public service. And therefore, the attempt has been there to make sure that these people are facilitated with their tools of trade, to make sure that when they come to work, they're only focusing on work and not doing politics or other things. And as the head of public service, I have to thank Her Excellency the Governor, because she has given public service all the support that is needed. She has made a lot of effort to make sure that she meets with them, even in our absence as the executive. Recently, she had a meeting with the director, she had a meeting with the ward and sub-county administrators, and she'll tell us to leave, not because we are bad, but she wants to hear the opinion of civil servants. What is going on? Are you being facilitated? Is your welfare okay? Are people getting services as they should? Are resources trickling to the ground? On regular basis, she will go to the sub-counties and meet with civil servants. She'll give them free microphone, no victimization. Tell me what you want me to hear about your welfare, about service delivery to the people. And these forums have been very public because there's need for transparency. And therefore, with such approaches, I would say that public service in Nakuru is protected from politics.
How many people work for Nakuru County?
We have around...
How many live, how many ghost?
No, we don't have ghost workers. We did the biometric registrations. There has been stories of head counts. You see, when you do a head count and you don't do any biometric registration, Dr. Mwaura can tomorrow be somebody else. So what happened is that Her Excellency instructed that we do a biometric registration of all our employees, and that is done. So if I brought a laptop here, I can tell you who works where. I can show you the image, their fingerprint, their certificates. And therefore, and it's on this basis that a digital human resource system has been built. So that now all the human resource procedures are now being done online. And one of the key requirements of this human resource system will be a clock-in, clock-out system, so that you can be able to account for what you are doing. Do you come to work every day or not? And therefore, this system they are concluding the development. I can report the training for human resource officers is going on as we speak. And therefore, again, the issue of ghost workers will not happen.
When did this take effect? Because there have been ghost workers before.
The biometric registration happened early in the year 2023. And since then now, we have been building a human resource management system. We didn't want off-the-shelf system because we have had an off-the-shelf system that are not working. So based on the biometric registration that we did, a team was hired to develop a system internally that will work for us. And therefore, the so-called ghost workers, yes, we had staff in our payroll who were interdicted in 2016. They had not come back to work. The disciplinary process had not been concluded. We had staff whose salary was stopped in 2013-14. They are still reflecting our payroll. So they are not being paid, but it has been stopped. But the practice is that if you are left the service, you should be deleted from the payroll because somebody can come in the future and reactivate and start earning. And therefore, through this biometric registration again, a proper audit was done, and everybody who is not in our payroll and their salary was stopped for whatever the reason, a process has been done working with the board to conclude the process. So if it was a disciplinary process, those processes have been concluded. You either have exited service, or if it was unfairly done, some people have been called back, so that we also fair to everybody. So these people appearing on our payroll, they may not be earning, but they are not our employees. They are being deleted, so that now our payroll is clean.
You know, one of the things, Mariam, is that, especially in the National Assembly, one of the pushbacks against increasing budgets to counties has been on the issue of counties are just employment bureaus. that these people come in there, everybody is just hiring. A new administration comes in and they hire people.
Right.
And then if you look at just the county wage bill, how much money goes into counties and what percentage of it is actually going into paying, just recurrent expenditure, wage bills and all, and how much of it is going into development has been an issue. In fact, you raised this question a couple of weeks back,
right.
With the chair of the Council of Governors.
Same thing here. But I'm hearing what Doc is saying. I don't know if Nakuru has the same issues. If you have digitized the processes, then you should be able to have streamlined it such that you don't have ghost workers, like you've said. But also replication of duties is also, because it could be you are legitimately on the payroll, but are you doing meaningful work? Are you doing work that has been replicated? Is it a bloated wage bill because of unnecessary roles as well? So has there been a move to now to block the other leakages that may be legitimate employment, but not legitimate for the taxpayer, Nakuru taxpayer, and count national as well.
Thank you. What there was across public service, there's some procedure manuals, some policies, and some guiding documents which were supposed to be there. One of the policies that is there in public service is that the ratio of technical to non-technical staff, technical to supportive staff, technical should be 70%, supportive staff should be 30%. But for you to be able to enforce this, you need some policy documents such as staff establishment and what we call human resource procedure manuals. These documents were non-existent. They were actually developed by the task force that was formed by Her Excellency Governor Susan Kihika. And therefore, what has been happening since devolution is that recruitment has not been guided by any policy document. So if I'm a chief officer, I wake up today, and I think my brother only qualifies to be a clerk, then declare a position of a clerk.
Right.
And therefore, you go to most counties, there's this discussion that yes, we have a bloated workforce, but yes, when you go to critical service areas like the health sector, like the environment sector, we have critical shortages of critical staff. So where is the mismatch? The mismatch has been how we are doing recruitment. And I'm happy for Nakuru County Her Excellency, before she did even one recruitment, apart from the critical staff like the CCs and the transition staff and the staff in the office of the governor, we first developed these critical documents. We now have an approved staff establishment. And therefore, if today you want to do a recruitment, it will not be based on who is in my village has what qualification. It will be what will be the basis of the need for service delivery. The other thing is that this document will now also help us make sure that now, internally now we have done an audit. We understand the skills that are there internally. We have a lot of staff that came in as clerical officers, as support staff, but they have some qualifications. So through this biometric registration...
Mariam has a degree in space studies. Let us open a space bureau.
No, it can't happen. Because now, remember, we have developed a staff establishment. So we already know what is needed.
I want to stop you just because of time, but I've heard you. It's just that I have a few questions that I want to get to before we run out of time. Okay. There's 2 questions on hospitals, and then there's one on policing that I really want to get to because of a statistic that I saw yesterday and that really alarmed me. But Jeremy Mutuma says... Stan Stivo, is Gilgil Psychiatric Hospital under the auspice of Nakuru County? If so, why are patients forced to buy monthly injectable antipsychotic drugs, as I have done for the last 2 years, at over 2,000 shillings per dose? That's question 1. There's also a question of another hospital. I'll find it as well. But
it's the one. It's the one that stands out like a sore thumb. The War Memorial Hospital issue.
Yes.
Yes. Who owns this facility?
Nakuru Memorial Hospital. Yeah. Under whose ownership and management?
And what's the status right now? It was closed, it was open. Is it open? Is it operational?
Thank you so much. For Gilgil Hospital, first of all, Gilgil is the second psychiatric hospital in Kenya after Mathare, and the second biggest psychiatric hospital in Kenya. Gilgil serves half of this country. If you take from Naivasha all the way to Kisumu, all the way to Turkana, all chronic psychiatric cases are referred in Gilgil. Because if you, all level 4, level 5 hospitals have psychiatric services. But if you have a chronic case, they are not able to handle within that hospital. So Gilgil is the second and the most specialized hospital for psychiatry. The second issue with Gilgil is that despite it serving half of the country, it's only supported by the county government of Nakuru. So we are not getting any additional allocation from anyone. But the government has decided that we have to continue offering services irrespective of whether you are from Nakuru or not. The third issue with Gilgil Hospital is that we inherited a very big wage bill debt from the national government. Because again, these patients who are in Gilgil, we have some patients in Gilgil Hospital who inherited from the colonial government, and they're still there. They're still being fed, they're still being clothed, they're still being taken care of. So the resource the resources available within the Gilgil Hospital sometimes may run out, and becomes sometimes very difficult to plan for that hospital because you do not have the ability to know what is going on in Siaya County, in Garissa County, in Samburu County, because sometimes you have cases of incidences in North Rift, and you have a lot of referrals because of stress and such kind of issues. So it's true sometimes we do have stockouts in that facility. We have made appeals to the Ministry of Health because the data doesn't lie. We have evidence that most of these patients are not from Nakuru County. We are making an appeal so that we get a special allocation for that hospital.
Would you like to hand it over to the national government so it becomes a level 6 national mental referral institute? Like Madare.
The policy directive within the county government of Nakuru in this regime and the previous regime is that for those functions that are devolved, they remain devolved. Let's see how we can collaborate with the national government. Let's see how they can come in to supplement. But those resources are devolved for the people of Nakuru. And it's not unique to Gilgil. PGH Nakuru serves about 10 neighboring counties. Naivasha Hospital serves around another 6 neighboring counties. And therefore, if we start handing over these facilities because we are carrying burdens from our neighboring counties, then we might reverse devolution in a very big way. And therefore, the strategy and the thing is that we collaborate. And we're happy, for example, what I said. When Her Excellency talked to the President, we have given resources to complete the trauma center in PGH. So we aren't saying the support is not there when we ask. So for Gilgil, we are still trying to make a collaboration with the national government to see the assistance we can get. But the discussion on handing over, so far we are not for that.
In the interest of time, War Memorial Hospital
very quickly. War Memorial Hospital very quickly. There's a committee that was formed pursuant to the court order by a court of appeal. That committee has representatives from the county government of Nakuru. I sit in that committee. It's an interim committee. We have representatives from the War Memorial. The chair of the committee is from War Memorial. The committee was asked to reopen the hospital. We are still sitting down. We are still having discussions, and we do report to court. We did complain to the court, to the DCI. And when we found inconsistencies in their document, when they applied for lease, and after that, the DCI did the investigation and they prosecuted. As to who owns War Memorial, there's a civil case we have applied as a county government, and we are seeking the court to determine who owns War Memorial, and we are hoping that determination will be done soon.
What's the contention?
The contention is one, this facility, if you look at all the former War Memorial hospitals, because War Memorial hospitals were constructed by the colonial government. This facility was constructed in 1923 by the colonial government, and all the other facilities that were constructed by the colonial government were handed over back to government. If you look at War Memorial in Nakuru, in Nairobi, it was converted to a military facility. If you look at the War Memorial in Eldoret, it's under the custody of the national government, of the county government. So the thing is that even this War Memorial was quasi-private public around 2013-14 because the board, in the board of directors, we had the provincial commissioner represented and we have the provincial medical officer of health represented. But after devolution, they threw out the public interest. And if you go to War Memorial again, it's one hospital between War Memorial and PGH Annex. It's one facility separated by a door. And therefore, it was necessary to determine the ownership of this hospital. But we believe it's a public facility, but the court will decide because we have gone to court, we have given all our evidence. But the most critical evidence that was there is that the directors who are claiming ownership of War Memorial were born after 1940s. But the certificates they are bringing of ownership, they claim they own that facility in 1923. And that's the evidence we took to DCI saying this is not possible. The second contention was how were public interest, the directors representing the public, removed from the trust? That was the other question we were asking. So that needs to be addressed, and there's a criminal case to that effect.
I think it would be a disservice to end the interview without talking about policing in Nakuru County. I know there's about 10 officers who are in custody over a shooting that happened recently. There was also a civil society report that came out that said about 49 people, 49 people have been killed by police this year so far. 22 deaths reported in Nakuru and 11 in Nairobi. Policing in Nakuru seems to be, I don't know what to call it. 22 deaths in Nakuru alone is a really scary statistic. County Secretary. What is happening? What is the county government's resolve? What is the issue? What is the state of security? All of that. And of course, how do we find justice? Because 22 deaths is quite a lot. It would be odd to say that all of those were probably justified killings. Just give me insight into that number. And of course, into the arrest and investigations that are happening right now as far as police shootings are concerned.
Thank you. On this matter, first, as a county government, our role is very minimal, but we have a major role. And one of our major roles is to work with the community, first of all, to maintain peace, we also have to advocate for peace as a community. And one of the things Her Excellency always does is to make sure that she's meeting with the County Security Committee, first of all, to give them the view of the community and the public, the concerns of the public, but also to understand the difficulties they're having and to facilitate them with anything they may need in order to make sure that they're able to do their work. For us is to appeal to the people of Nakuru. Whenever there's an incident, let's report to the security forces. Let's work with them. Because this insecurity, because again, if we're not focusing on the issues of police, there's also a huge insecurity issue that is in Nakuru. And therefore, the police is trying to address the insecurity in Nakuru. And therefore, for me, is to appeal to the community. If you have any issues to do with security or the police force, we are available as county government. We can be your advocate, bring the information to us. We always sit with the police force and talk to them. We are there to facilitate anything that is needed. We have a bill that was passed by the county assembly, a bill that is called Peace and Conflict Bill, which is we are trying to. What happened? It was passed in the previous county assembly, but the process of gazetting it was not concluded.
Right.
We are working with the civil society, an institution called SEDGG, and the county attorney's office to make sure that we gazette this bill and it becomes into law. Because one of the efforts we are trying to do is to make sure that we get resources from the public, from the civil society, to bring education to our community. We have been able to educate our enforcement officers through these initiatives because it was a source of a major conflict. And we believe when you operationalize this bill, because there will be resources for a lot of dialogue between us, between the police force and the community, so the conflicts that are there within the community can be resolved through dialogue rather than through force.
Is there
Conflict resolution at that level, and then also now handing over. National government has the mandate of security.
It does.
And so on. But let's continue this conversation as we enjoin the citizens of Nakuru and the residents of Nakuru County into the conversation for the next 2 hours. Mike Ground live at the Nyayo Gardens in Nakuru. The gates are open. Kuja, tafadhali, come and join us and let's have this conversation. We've been having a conversation with Dr. Samuel Mwaura, who is the County Secretary for Nakuru County. From here, Mike Ground at the Nyayo Gardens in Nakuru. Back in a moment to take the mic now to the ground and engage with more people.